1940s in Gurgaon, India. As I'm an attendant of liver transplant surgery, today I'm going to share my experience. What's the main cause of liver disease? 40,000, 50,000 people suffer from liver disease around the world. These type of patients should come to the 40s in order to get good care from professional doctors. First of all, patients and donor attendant will come to the 40s, and patients donor should get several tests, and test reports are collected and they are sent to the transplant committee. Transplant committee will give either positive or negative response. If it's positive, they will be sent to the pre-operational stage. In the pre-operational room, they will also take a little test in order to be sure their condition. In the operation day, the main responsible person is Dr. Vivek Vij and his team. His team consists of more than 30 people. This operation is so hard because it takes from 7 hours to 14 hours. After operation, donor and patient will be sent to the ICU rooms. In ICU rooms, they will get good care, and also they will be discharged into different times. Patient will be discharged from 2 to 3 weeks. The donor will be discharged in 1 week. Well, they will get back to normal life. The patient will back to normal life in 6 months. The donor will get back to normal life in 3 months. The donor's livers, 60 to 70% is taken, but both livers will be grow in a week or in 10 days. Although it's really hard surgery, professional doctors can do this successfully. Now we are going to talk with Dr. Vivek Vij. Good evening, Mr.
Good evening.
Well, this is Dr. Vivek Vij, and he's a professional of liver transplantation surgery. Dr. Vivek Vij is a past liver transplant surgeon in India with vast 20 years of vast experience. And my first question is about what's your ability to face the challenges, both medical and personal?
Okay. So when we talk about challenges in professional life, there are lots of challenges, right? But the whole crux of situation, or what motivates us as surgeons, is to save a patient's life. In the end, it's a smile on the face of patient and their relatives that is much more gratifying than the financial gains. So that is what we look for. I want to save every life who comes to me for surgery. So that is my motivation. Regarding my personal challenges, there have been a lot of personal challenges. They will remain, like you have personal challenges. Everybody has personal challenges. Rearing up kids, their education, then fighting with diseases. So of course I am a very strong man. I do everything with courage and right decisions. I don't go on a wrong path. I always try to select a righteous path. So that's what it is.
That's great. And you have lots of students, right?
Yes.
And also, I'm sorry. Well, you work in Fortis and also runs a fellowship program for training
Yes.
young surgeons
Yes.
and paramedical staff at Fortis.
Yes.
Well, my question is about how many long period your students will be able to perform surgery independently.
Right. So, as far as liver transplant surgery is concerned, there are two things which are very important. The first thing, it's a complex surgery. It requires a longer time of training for any newcomer or any fellow. Okay, this is one thing. And secondly, of course, it's a teamwork. We don't advocate any surgeon doing liver transplant surgery alone. First of all, they have to build a very competent team along with them to do this kind of surgery. Now, as far as what is adequate training of a fellow, then we advise that at least 100 liver transplants should be seen and assisted by a fellow before embarking on an independent journey of doing liver transplants. So 100 transplants at our center, we aim at giving fellows hands-on, right? So then they slowly and slowly learn. 100 donors and 100 patients. Yeah.
I see. And also, I researched about you. You have more than 50 publications in international and national level. My question is about liver transplantation. What's the difference between 35 years old donor who gave her or his liver between and 45 years old donor who gave his liver for patient?
Okay. So the difference between 35 and 45 should not be too much. Number one, difference should be between 35 and 55 and 60. Okay. So as we grow older, the capacity of our hepatocytes or liver cells to grow decreases. Okay. Then we say it, liver grows older. There is no upper limit of donation as far as certain transplants are concerned, but for liver transplant, we restrict ourselves to 55 years of age. That is the upper limit. Beyond that, beyond 55 years, the results of liver transplant might suffer or donor might get complications. So obviously, to answer your first question, 35 years is better than 55 years, okay, because liver regeneration, liver cells are very good. So slowly and slowly they recover, patient also recovers. But up to 55 years is acceptable, and if some person is donating for a child, then up to 60 years is also perfectly okay.
Wow, thank you. I have also an interesting question. Is there any difference you operate strangers and you operate your relatives?
So till now I have not had the opportunity of operating on my relatives, but obviously if they are very close to you, then you try not to operate on them. Okay, that's not for the reason that hands would shake. That's for the reason that there are lots of complications in surgery. You don't want to blame yourself for lifelong after the surgery is done. It's better to find a more competent surgeon and do surgery with them, right? So I would not like to operate on my mother or my brother or my sister, but of course if it's first degree or second degree relatives, then of course I would like to operate on them.
Thank you. And also you have achieved lots of awards in your throughout your career. And for example, the award in the International Liver Transplant Society in Chicago, and Roach Preceptorship Training Program from the University of Alabama, USA. Well, there might be such cases. The medicines and advancements of medicines may offer you some offers to advance their product to patients or to others throughout the media. Have you ever been in this situation?
See, the market is driven by pharmaceuticals. Okay, there are a lot of products which are coming daily, day by day. There are a lot of markets, but I can assure you that we don't get influenced buy such products. If we feel the product is good, then only we write the product. Otherwise, we don't. And the difference between different various products is some patients they prefer low cost products. Some patients they prefer high cost products. So depending on the needs of patients and the profile of side effects, we choose our product. It's not that we will write one medicine for all. We will not promote a single medicine. Whatever suits patients, we advise that.
You are the most professional doctor because with your team you have performed 2,600 operations, surgery, and with yourself, only yourself, you took surgery 800 by yourself in
More than 1,500 now.
Yeah, more than 1,500. That's a really great achievement in your throughout career. And that's why I'm really amazed. And I have like such question: if Uzbekistan offers you to come to Uzbekistan, and I know you went to Uzbekistan, you have been several times.
Yes.
And if you come to Uzbekistan to establish your own hospital and work in Uzbekistan, would you get this offer?
So, I think there are two parts to this question. One, would I like to help Uzbekistan people to set up a transplant center? The answer to that is yes, of course. We are running some transplant programs in different countries. Like I started program in Mongolia, I started program in Nepal. We are still running that program, and we are training local people also. So if the vision of Uzbekistan government and people is to start transplant in due course of time, 7 to 10 years, of course I am willing to help them. The second part of question is, would I leave India and settle there? That is no. I would definitely not leave India. I can extract time out of my busy schedule, go there, do surgeries, set up the team, train them, and then come back.
Thank you so much for spending time. I really like good luck to your all
Thank you so much.
Future works. Thank you so much.
Thank you so much. God bless. Namaskar.